medicine had names or hospitals. There was only water and light. From that cosmic ocean, the gods and demons churned the sea of milk in the search of immortality. Out of those waves rose Davantari, the divine physician, radiant and holding a golden vessel of Amrita, the nectar of life. That moment was not just the birth of medicine, it was the birth of living medicine. Davantari taught that healing is balance, not battle. Water must flow. Fire must transform. Earth must nourish. Air must carry breath. From these elements came the leech, the teacher of renewal. It reminds us that decay feeds life and that release creates flow. This is the foundation, a remembrance of harmony between nature and body. I know we've just talked about AI, but we're going really ancient now. Way back. Which is beautiful because it's just in time. So, I started out with these leeches a very long time ago. I noticed that Davantari had a leech in one of his 8 hands. At the same time, the FDA approved leeches as a medical device. I traveled through India for about a year and was absolutely amazed by the leech. And in classic imagination of Ayurveda, the image of Lord Davantari emerges with a humble leech as its living instrument of purification. So, we've had leeches for a long time in our medicine cabinet. Even today, our surgeons, when we find a necrotic toe or ear being trying to be reattached, it's the only thing that really helps save limbs, microsurgical reattachments. So before we start out with the history, let's just bring it up to the current of what's lately been an impact with leeches. And in Tallahassee, during the pandemic, Joseph Latipo, our Surgeon General of Florida, stirred controversy by urging the pharmacy chain CVS to carry leeches. The ancient Egyptians used leeches in medical treatments more than 3,000 years ago. Latipo said at his confirmation, unlike some quote-unquote vaccines, leeches have stood the test of time. Latipo said that he was dismayed when he recently visited the CVS and found plenty of masks and test kits, but no leeches. There wasn't even a leech aisle. Praising Latipo for thinking outside the box to combat the pandemic, DeSantis confirmed that he was mulling a leech mandate for Florida schools. So, leeches are very fringe. There's probably around 25 therapists in India, I believe. At least I post on Instagram and Facebook. And in the United States, it's also a very rare art of medicine, but I'd like to share it with you today to know that even though we're looking forward to the future, we do have in our hands what our ancient ancestors helped with a lot of conditions. So I believe, don't quote me on this because there's no research on Google that I could find, but that the symbol of medicine aren't mythical snakes. I believe they're leeches. Since the dawn of man, through various cultures, leeches have absolutely been nature's surgeon. And we can see that throughout history, from Cleopatra to Demi Moore, leeches have been quite the tool, but more than the tool they are. So, in my personal opinion, Demi Moore and all these Hollywood actresses that are looking amazing nowadays, I really believe it's because they're putting on leeches. I have no research behind that, but it's been absolutely a rave from Demi Moore that she loves her leeches. And from Cleopatra to one of our famous A-listers, I just find it's incredible how much history is behind medicinal leeches. Napoleon lost the Battle of Waterloo because he was hijacked. His doctor's leeches were stolen right before he had to mount to go into battle. His really bad case of hemorrhoids prevented him to actually win the Battle of Waterloo because the leeches were not there. So that's a great example of how leeches have shaped history. George Washington, unfortunately, passed away from medicinal leeches since they used around 80 of them, which is a little too much. You know, you don't want to go crazy, but it's a little too much. So unfortunately, we've had some bad cases of leech therapy being inappropriately used. For thousands of years, modern medicine has become sterile, afraid of the wild. And it's interesting that now we're just having some attention towards medicinal leech therapy. In the New York Times last year, I was featured for the organic facelift, which is using leeches to detoxify the swelling that comes with aging. These leeches are amazing. They've had great historical emphasis, but the reality is, just like all of nature, we really need to come up with better solutions. So the types of leeches around the world, there's around hundreds of regular leeches, but only about a handful that are medicinal. And the most commonly used medicinal leech that we have now is the verbena leech, which comes from the Mediterranean. It's highly endangered, and the original leech we use, the medicinalis, has become almost extinct, and it's not used in medicinal leech therapy whatsoever. The problem with using just one variety of leech is that you endanger its habitat. So in Turkey, you would be able to wade in the water and have around 50 leeches attached to you in about an hour. That was about 10 years ago. Now, in about an hour, you can only naturally attach 5. So the leech supply is dwindling at an insane rate. And that's why I think it's important that we start figuring out ways to help the leech help us. So my recommendation is the Asian buffalo leech, which is not endangered. It's an Ayurvedic leech, and that needs to replace the verbena since it has been exploited to the point where it will become extinct probably in the next 20 years. So I would definitely recommend that if you do find a leech therapist, that they have quality leeches that are not endangered and have been in nature, farm raised. I went to Moscow, one of the largest breeding facilities in the world, and saw rows and rows of leech jars and amazing production of leeches, but we really need to take care of the wild ones and raise them in nature. So I hope that we can figure that out as a planet to protect our resources. This is one of my most dramatic before and afters. It involves placing the leech not on her toe, but using distal points that help blood flow. 5 doctors wanted to amputate her toe. They couldn't find a solution. It was already auto-amputating. So we placed leeches distally, and it revived her toe within around 5 sessions. You can see here how incredible leeches have an impact on blood flow. And what I find interesting, there's many different styles to leech therapy. So placing them on the area itself, which is almost like common sense. However, there's an art to it. So what I've combined is using acupuncture points with the leeches to create an incredible heel of this toe. The leech has amazed me. I've never found anything so incredible like this leech. I traveled to over 25 foreign countries searching for ancient cures that were effective, and this leech is what I'm proud to say is the best thing that I've found, because it is an incredible way of healing. This is another patient of mine who had chronic sinusitis. He was on CPAP machine. He was very weirded out that I asked him to put leeches inside his nose, but thank God he trusted me. Because when he went back for his CPAP prescription refill, they studied and they found no breathing obstructions. So, an incredible result from the leeches being able to not only just open up his eyes, but relieve his spirit. This is within an hour, if you can believe that. This is all the toxic lymph fluid that can accumulate with stress, poor diet, aging. And I love how the leech can naturally drain toxicity, because somehow in its chemicals of its saliva, which is over 100 different bioactive chemicals, it will inject for the first 15 minutes its pharmacy of enzymes, and then pull up 80% lymph fluid. So swelling that's stubborn to get rid of through diet and exercise, with the leech, within an hour, to have these sorts of visible changes and visible or feeling amazing after it is like no other. Most people are scared of leeches. They're like, does it hurt? Am I going to have a bad reaction? No, no. In fact, their saliva makes you feel relaxed. It makes you feel like you're flowing with life. It relaxes you. And you barely feel them. Most people, when they go into a pond, they're like, I don't even feel it until they leave the pond and they notice the leech sucking on them. That's how strong their anesthesia is within their saliva. So, if anybody's wondering why my face looks barbecued, I will tell you now. So this is a little off leeches, but I wanted to share it with you because you are witnessing my journey of transformation. And so, plasma is the energy of lightning. And we recently harnessed this power of energy. And somehow it kind of translated over to skin care. So this is a picture of me before and after this plasma fibroblasts healing. I've done this on myself multiple times. It looks like it hurts a lot, but it's just about bad sunburn. So I wanted to share that with you because also an element of nature, opposite of leeches, is this fire needling. And a little about where I practice is in a very special place on the planet. I believe that people need to experience nature to heal deeply. And when you're by a waterfall in the jungle, you naturally resonate healing. So I combine these treatments with the atmosphere of healing in Minca, Colombia. My mom's had a place there for about 20 years. We've developed it into a beautiful area of healing. It's the largest mountain in the world by the ocean. So naturally, the birds love it, and it's the #1 bird watching spot in the whole world. So what I've done is create a sanctuary for people to immerse themselves in nature, to be healed by the trees and the waterfalls and all that is gorgeous in this beautiful spot on the planet in a cloud forest. I find it's important that we recommend to patients more of a natural approach. And medicinal leech therapy is quite strange for many people. So I've offered it as a total experience, since one bite of medicinal leeches could have you oozing out fluids for about 24 hours. So if you're taking care of, say for example, osteoarthritis of the knee or varicose veins, you're probably going to be using around 5 to 10 leeches and have a bloody mess. Like we're talking biosurgery, blood, bandages that need to be changed every hour on the hour in the beginning, and then afterwards every few hours. But that's where the magic happens. So I feel like it's the best scenario for the patients, for the leeches, for me, to attend to patients while they heal in nature. I feel I can ask you questions if you'd like to participate in my demonstration. Feel free. I think I only have a few more minutes. Yes, sir.
there are some patients who are on blood thinners like warfarin or this heart disease, AFib. They are on some of the blood thinners like Aliquip. Can you use the leech therapy on those patients?
Those patients, I would recommend that they purchase an INR device.
Okay.
That's real-time information, because that's always tricky to recommend to a patient. Just reduce your blood anticoagulant medication for 3 days. Who knows? It may take 5, it may take 7. So I would recommend an INR device.
But let's say if their INR is therapeutic, where it should be, will you do the leech therapy?
Yes.
Okay.
Because what comes out of the drainage is lymph. They
Okay.
only lose about 20% blood. So it's a common misconception that these leeches will cause anemia. Actually, we can practice safely with a hemoglobin of even down to 8, because sometimes, especially with liver issues, you need to regenerate the blood flow and take that chance of them not feeling strong for a few days, because obviously they're on that borderline, but it's quite an impact on their blood flow. Hope that answered your question.
Thank you.
Sure.
So even if the leech doesn't necessarily take up a lot of blood, like you said, it's only 20%.
Yeah.
If you're using the leech in the someone with blood thinners, and it causes, say, a little bit of irritation damage to the blood vessels,
Right.
and causing some outflow of blood in their own blood thinners, do they usually get like hematomas, or do they have to worry about like a little bit of hemorrhaging in the area?
Definitely a lot of hemorrhaging. We're talking about like the
Can you repeat the question so we can hear it?
I could rephrase it.
Yeah.
Thank you.
Basically, wait, let me see if I can. Basically, the most common side effects are bruising and hemorrhaging. Hemorrhaging being the number one, where, that's where the magic sauce is. So basically, in their saliva, they have an enzyme, hirudin, that's 10 times more powerful than heparin, which is the strongest pharmaceutical blood thinner. So we're talking about one bite, probably leaking out 50 to 100 mLs of fluid, of stagnation, which causes some bruising, sometimes, especially around the sucker of the mouth. But it's cute. It's actually in the shape of the Mercedes-Benz, But in all my years of practice, which is almost 20 years now, I haven't seen an infection, but I have seen them on the internet. And I don't know if it's propaganda, I don't know what's the deal, but I do believe, this is my theory, that in Western medicine, when you have nurses at hospitals who really don't pull out the leeches very often, they freak out, they take the tweezers, and they squeeze their bellies, which is no. Because then they can regurgitate some sort of bacterial microbe that causes an infection, which we've seen in mostly surgical settings, which is a very rare side effect, but I believe it's because of mishandling. On the contrary, I've had patients that have had infections that don't respond to antibiotics, repeated. And leeches have only helped infections. I haven't seen any cause.
I'm sorry, after how many times, how many hours do you
I'm sorry. I have to take the question first.
After how many hours or how many days you remove the leech, or how do you know that, or the leech will fall off on its own?
Yes, you always let it finish.
I'm sorry?
On its own. There's methods of removing, but you always want to not rush the process. So that's why it's kind of impractical to offer leech therapy in a normal clinic setting, because it could take 3 hours. It could take 4 hours. And then they're bleeding. Sorry, go ahead.
Yeah, the question was that leeches, as I have studied in Ayurveda, only sucks the blood out and not the lymph channels. The lymph or the lymph channels. So is that the plasma you're talking about in the blood? Or I just need some clarification on that one?
Well, I think it's mostly lymph because when people bleed out, they actually have almost a jello-like consistency. It is incredibly fatty, and it actually smells. So in my intuition, I believe it's lymph. And from what I've been trained, where I got certified in Moscow, in Germany, did an internship in Turkey and in India, it's always detox. It's always toxicity that flows out. And only about 20% blood. So that's why I feel that people have a common misconception that it's mostly blood. It's not.
Is it possible that when the leech is sucking the blood out, it has its own chemicals that are changing the chemistry of the blood?
Oh, no doubt. No doubt.
What was the question?
I want her to repeat it.
The question was if only blood came out. And from my experience, definitely it looks like blood, but it's blood pudding. It's very jelly-like. And then from when people,
Isn't that because of the, when anytime you bleed, right, there is the clotting mechanism in the blood?
right,
And is it possible that when the leech is actually sucking out the blood itself, there's some changes that goes on that
oh, definitely.
regurgitates, it is not the same anymore.
Oh,
So
no,
how can
no.
we know if it is lymph or just blood?
You can tell by the consistency of it. It's going to be like a jello. It's going to be almost fatty-like.
I
think that's a good research question. Need to research what comes out and basically the material. But I think it's like a more as a plasma and more inflammatory cells. So there will be lymphatic cells as well, and neutrophils and all blood cells, and because inflammatory cytokines and all. Because mostly like the leech we use in Ayurveda is as more as an inflammatory conditions. And it reduces the inflammation. We call it just sucks the Ashuddha Rakta. So Ashuddha Rakta is like more as an inflammatory blood cells and all inflammatory extracellular fluid and all that inflammatory, I would say like as a material. Like inflammatory cells, cytokines, interleukins, all those things. So it helps to suck out those, and when it reduces the inflammation, the patient feels better with his pain and all inflammatory signs. So that's a good research question. If we can evaluate that fluid, what it comes out, to find out exactly what happens in different
Well,
patients.
no, they have. They've done research already. The countries that have really focused a lot on it, Russia, Germany, and
So it's always like a lymph what they find in the research?
the lymph is, yes, they're basically lymph suckers.
Okay,
They're not blood suckers. Common misconception.
thank you.
Do you know about the legality of doing, I know you're an MD, but for others, what would be the requirement for someone to do the leech, like an Ayurvedic practitioner? Do you know what would be the requirement?
Well, I believe that you gotta know what you're doing with a leech. So you definitely need some training. And the only way to protect yourself legally is to get some training and join a church. Okay? So I started a Church of Living Medicine, and it's under my religious freedom to practice. And I train practitioners in a beautiful setting. I help patients harmonize with nature. And the Church of Living Medicine is my way of helping those that need it, the leech and the patient included. Yes, sir?
Breast cancer-induced lymphedema, can it be helped by leeches in that case?
Whenever we talk about the language of medicine,
Sorry, can you repeat the question, or do you want me to shout it? Can you ask it again, please?
Lymphedema caused by breast cancer in the arms, can it be improved by leech therapy?
Of course, nothing can be cured. However, there's a type of bleach in Indonesia that has been used for specifically breast cancer clinics around Jakarta. So I suspect that they may be helpful. There is no research behind it.
Thank you. One more question, Dr. Rodriguez?
I would like to add a comment on this question.
What
What breast cancer you are talking about. So, breast cancer is described as Stana Arbut in Ayurveda, and in Charasavita, in different treatment modalities. One of the modalities for Stanya Arbudam or Stanya Vidrati, which is abscess, is leech therapy. So yes, we can use on that.
Thank you.
Here's our last question. Thank you again for your time.
Thank you. This question is more related to if you can describe briefly the maintenance of the leeches and if you can use leeches in different people or just exclusively to a person.
Exclusively to a person. So if you see the historical French vase in the middle of everyone's living room back in the day, they had leeches and they showed them off in their living room as their pride and joy. So if you go to the market in Turkey right now, you can find leeches in the market. They sell them to the little old ladies who want to walk better. Basically, I'm sorry, I forgot your question. I'm so
The
sorry.
maintenance, like you have your leeches, how
It's-
long they last?
It's sad that in the United States, medicinal leech takes 2 years to grow. And when you use them, you have to dispose of them as a medical device. But as a sacred being, I think they become one of your loved ones. So you should treat them accordingly. They live for around 10 years, and they feed every 6 months, up to 2 years without feeding. So they live a long time, and they have a symbiotic relationship with humans for a very, 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 very long time. And I think it's because we separated ourselves from nature and from leeches that we have all these issues. So the maintenance of them, if you keep them as a sacred being, is a long and loving relationship. But in Western medicine, they're discarded after every use, and you don't share your leeches. There you go.
You shouldn't use them?
In-
Probably you shouldn't.
in Ayurveda-
It's not shared.
I've heard in Ayurveda, they maintain them for the same patient and wait until they're quarantined and reuse them again on the same patient. That's your ideal situation, so that the leech lives to see another day. And it takes a long time to produce one, so obviously conservation is key.